Who am I? I'm an internist, hematologist, and medical oncologist. But over the last few years, I've been changing my field, and I work now full-time in the Akureyri clinic. But as you will see during my talk, I'm still thinking like an oncologist. Sorry about that. First, I will. This is the overview of what I'm going to talk about for the next 20 minutes or so. First, I want to introduce you the Akureyri disease, and this is the only thing that we are famous for in Iceland. There was an epidemic almost 80 years ago in the northern part of Iceland, and it was probably a viral disease. We don't know exactly what virus it was. It was like polio, but turned out not to be. And it spread rapidly in the northern part of Iceland in the years 1948 to 49, and 6 years later, it came back in other parts in the north, marked in the blue circles here. Red and blue circle. Red is the first epidemic, and the blue one is the second one. There was published a book just recently, a very good book about the Akureyri disease. Unfortunately, so far only in Icelandic. But we were famous because the scientists, the medical doctors at that time in Iceland, they did a tremendously good job in describing the epidemic. And they published it quite extensively in high-impact journals like Lancet. So the disease was called Akureyri disease or Icelandic disease for some while. So how did the patients with Akureyri disease fare in general? Well, some patients recovered, but 20% of the group were sick their entire life with disease, just like the ME that we know today. Was this a new disease? No, we know that. We have had a lot of epidemics of ME in the past. More than 70 epidemics have been described. And I mentioned few. Russian flu in 1889 to 95. For a long time, it was thought to be an influenza. But many think now it was a coronavirus, just like COVID. But neurasthenia was the name that was used at that time. It was described as a sequelae in quite many. And then we can mention the Spanish flu. Long-term consequences of that disease was common. We know about the Los Angeles County General Hospital outbreak in 1934 and the Royal Free Hospital epidemic in 1955 here in this country. And that made the editors of Lancet write an editorial. And the name of the editorial was A New Clinical Entity. And they were saying, well, it's really not appropriate to call a disease after some little town up north of Iceland, and call it Akureyri disease. We suggest we call it benign myalgic encephalomyelitis. But one of the leading scientists at that time in Iceland, he wrote a letter to the editors and he complained. And he said, I think this puzzling disease can hardly be adequately and permanently named until etiological and anatomical studies have better identified its nature. This could be written today, yes? So, some of us in Iceland think we should regain our name back. Little bit about the Icelandic healthcare system. We are a tiny population in a large country. Population is just under 400,000. We have universal healthcare, and it's mainly paid by our taxes. There is some public-private mix, but the private guys are usually paid by the government anyway. But now I will tell you a little bit about what we have been doing in Iceland regarding awareness of ME and long COVID. I think that's one of the best things we have done so far. And I would really like to thank the ME Society of Iceland. They've done a tremendous job. We clinicians, we have been trying to help. We have been writing articles in the newspapers. We have had a few symposiums at the medical conferences, the yearly one-week conference in January. We had a few symposiums there. We have made documentaries, and it has been aired on national TVs at least twice, each film. And this film was the first one from 2022, I think it was. It's on the internet. We also celebrated the 75th anniversary of the Akureyri disease. The two gentlemen here in the front are Akureyri disease patients. And we have made two more documentaries regarding ME and long COVID. They have now subtitles in English, German, and Spanish, and we are in the process of translating into Scandinavian languages also. You can use them as well. I would like to discuss a little bit about the disease burden. You can divide the burden. One thing is finances. This is a very expensive disease, not only for the individual, but also for the society in general. And it has been estimated that 1% of the global economy each year is the cost of long COVID in the world. And that's a lot of money. So I think we should act. What about the disease burden regarding the health? And I like to quote our dear Nancy Klimas. This is a long time ago. Do you remember this, Nancy? She said, I split my clinical time between the two illnesses. And I can tell you, if I had to choose between the two illnesses, I would rather have HIV. In one of the documentaries that we mentioned, there is an interview with a gentleman. He was 42 years old when he developed multiple myeloma, which is a cancer of the bone marrow, in 2020. He received intensive chemotherapy, including high-dose chemotherapy with stem cell transplantation, and then maintenance therapy. And he did tolerate the therapy poorly, but he gradually went into remission, and he was back to work. But a couple of years later, he was infected with COVID and developed long COVID. And he is asked in the film, if you could choose just one disease, which would you prefer, long COVID or multiple myeloma? And you can just guess what the answer was. Well, now I'm going to go to my topic, which is the clinic in Akureyri that we call Akureyri Clinic. This is a clinic for patients with ME and long COVID and related disorders. We are serving patients nationwide. It's within the national healthcare system, and we have coordination role for services for ME patients nationwide. And we try to collaborate with everyone that has interest in ME or long COVID. The clinic was officially started almost 2 years ago, and it was formed by the Ministry of Health, and the gentleman in the middle is the Minister of Health, Willum Thor. He was really proud of this project, and I heard often him saying that this was the best thing that he did during his time in the ministry to open up the Akureyri Clinic. But this is not a health issue. This is also a social issue, because there are a lot of people getting out of the job force, dropping out of school, having all kinds of difficulties that were not planned. So we have also met the Minister of Social Affairs, and I hope they understand what the real problem is. This is the homepage that we have, unfortunately only in Icelandic so far. And this is the team that we have up north in Akureyri. We have medical doctors, nurses, occupational therapists, physical therapists, social workers, and health information managers. And this is our campus in Reykjavík, which is in the south. And it's located at Landspítali, University Hospital. And what we are doing there, we are also seeing patients with ME and long COVID there, but also more specialized patients, like patients with multiple chemical sensitivity, which is really difficult group of patients to treat. There is a group with breast implant illnesses that Christian Erlendsson, who is here in the audience, is taking care of. He has a group of like 70 women with silicone breast implants that have ME-like illness and Asia syndrome. And then we are so proud to be allowed to join the Discover ME that Eva was presenting earlier today. Our role there is to provide blood samples and clinical data. And maybe Jonas will collaborate with providing Uppsala with spinal fluid samples. And this will be the start of our biobank. And we do collaborate with the University of Iceland, the School of Health Services. So what have we been doing so far? We are referral based. We only see patients with referral mainly from the general practitioners. We have seen 830 patients so far. Nearly all are quite sick, and it has surprised me how sick this group is. We have outreach clinics in other parts of Iceland, also, as we mentioned, at Landspítali, but also in smaller clinics around Iceland. And we have done some home care visits also. Unfortunately, we still have waiting list of 4 months, but we have no waiting list for children. So if there is a referral for a child, we will see that child next week. Our youngest patient is 10 years old, and our oldest patient is 97-year-old. We are supposed to create a national registry, and that we are still working on. And that brings up the question, why is it important for the Akureyri Clinic that other nations create structured services for ME and long COVID within their national healthcare system? But as you have heard, not many nations do provide that kind of service. And why does this matter to us in Iceland? And this is my answer. I predict that one day we are going to have a politicians that will start to ask, why should we spend money on ME service in Iceland when our big and rich brother like Norway thinks it's not worth it? We have had so far very good support from the Ministry of Health and for the Medical Director of Health. And the latest news is that the current Minister of Health, which is here on this photo, Dr. Alma Möller, who is actually a medical doctor, she has created a task force. And the role of the task force is to overview what kind of services should be included in ME, long COVID, but it's inclusive, it's not exclusive. We look at POTS and other autonomic symptoms, and we are also thinking of environmental illnesses, like we said before, the breast implant illness, mold intolerance, Asia syndrome, and multiple chemical intolerance disease. So I have been thinking, what is required for a special healthcare center? And remember, I'm an oncologist. So I asked the artificial intelligence, what is required from a cancer center? Well, they came up with this. It's expert knowledge, provides best possible care, very short waiting list, runs clinical trials, world-class research, access to tissue bank and biobank, access to national registry, collaborates with local healthcare, adequate funding, and international collaboration. This is what is required for a cancer center. I don't see why an ME center should be any different. What do you think? Well, I think we have to unite to fight. This group here, and I'm so proud that we in Iceland were invited to take part in this, because if not for eMERGE, we would not have started any service in Iceland. And here on this slide here, I put a few individuals up there that have been really helpful for us to establish our service. And I mentioned how important it was when one of our nurses and the social worker went to the clinic in Copenhagen. I myself went to the Nova Clinic last December, and now Per has invited us to come over to Sweden. So this collaboration is so important to try to learn from each other. We have, in this meeting here, we have been talking the clinician in the Nordic nations. There are some issues that we need to solve. And we mentioned here, there was this position, there is this group which is called Nordic Council. That's a parliamentary group from all the Nordic nations that meets twice a year. But they also have, the ministers meet quite frequently. And under the ministries is a group called Nordforsk. Nordforsk is a research group. And they published this position paper last year, Knowledge Development Post-COVID. And they state here that the Scandinavian nations need to work together. It's not optional. It's it's very necessary to do that. So, what do I think can be learned from our experience? It is feasible to run a ME long COVID clinic within the national health system. There is a huge demand for services. The clinic should be multidisciplinary. Guidelines on how to establish a ME long COVID clinic could be of help. I think if someone likes to start an ME clinic, there should be a guideline, what is required of an ME clinic. And I think much may be learned from improving ME care from existing structure in oncology. Creating awareness in the society among healthcare staff and politicians is so crucially important. And I put up this slide here just in case that someone would be interested in having a meeting in Iceland to remind you that we are really accessible from Europe and North America.